Behind me, quite a lot of activity as various delegates from all sectors of society, be it government, businesses, civil organizations and the like, have converged to discuss men's issues. A men's dialogue will take place today and also the men's charter. And as you can see, I've donned my green and gold box jersey in support of the men who will be taking to the field. But we're here to discuss and support men in various spheres of society, like I said. And my next guest does that, but on a much larger scale. I'm joined by Richard DeLate. He is from Brothers for Life. Very good morning to you. Thank you so much for joining us, Richard.
Good morning.
We've been discussing quite a number of issues that are plaguing society today and that can be traced to perhaps men in our communities. We are seeing the likes of 7-year-old boys, doing atrocities in the classrooms, raping, etc. The aggression that we're seeing in society. We were talking about university students and the rampage that we're seeing there. Why do you think we're so angry that our young boys and men are just so hostile?
I think, look, I don't want to blame it on history, but I think history has a very important part to play. I mean, our history in this country is resolving issues through conflict, and that's how we've been brought up. And I think also the other thing that's happening is a large number of young men grow up in single households, single mother household. They're raised by their mothers. And so their role models in society are the rappers, the soccer players, the celebrities, and some of those who just simply do not live a positive life. And then you've also got people around them who influence them. So what Brothers for Life tries to do is really to find male role models, men who are doing things to try and change their communities and get them involved in the program, really around promoting men's health in general, but also promoting issues or addressing issues such as gender-based violence. The Patrick Shy campaign that we ran, I think, was one of the most successful campaigns we've ever run. The call rate to the Stop Gender-Based Violence helpline during that campaign by men exceeded women within the first 4 months of that campaign. And so I think that shows that men want to be engaged, men want to see positive role models, and men want to be part of the solution. But unfortunately, we still don't have services for men. So when we look at gender-based violence, these men phone, where do I go? Where do I get help? And there's very little available. Even at the healthcare center, when men go into the healthcare center, why are you here? The attitudes towards men going to the healthcare center. So we really need to look at health services. We need to look at making more services available for men. And I think, the Medical Male Circumcision campaign showed that when we make services available for men, men do come. I mean, we've had about 2 million men circumcised in the last 3 years, which is a phenomenal accomplishment if you think about it. But we have about another 2.3 million that we need to get in order for us to get the HIV rates or the HIV benefits. So, there's a lot more work to do. Our testing rates amongst men, we have seen quite a nice increase. About 50% of men have ever tested, but it's much lower than women. So we still need to get to men who are the most vulnerable, and those are the men who are unemployed, who are in the shebeens. Those are the young guys we have to reach.
And in all fairness, I suppose there are some good guys out there, and quite a lot of the good guys out there. And it's just the few rotten apples, shall we say, who spoiled the barrel. The good guys who are saying, I need to do something as well. I'm aware of what's happening in our society. I am supporting my children. I am supporting my family. I'm doing all that needs to be done. But I need to do more. How do they come together and become institutionalized, I suppose, or join Brothers for Life to contribute to the betterment of the whole society?
It's not about joining an institution. It's about making a difference in your sphere of influence. So if you have a nephew and you see your nephew doing something that you think is not right, break the silence, say, hey, you know what, that's not cool. If you're in a pub and you see a guy sexually harassing a woman, stand up and say, you know what, that's not cool. Until we start standing up within our own social sphere and saying, it's not cool to do this, we're not going to break it. So that's what Brothers for Life tries to do. It tries to encourage men within their sphere of influence to talk to other men. It's about men influencing men, but now we've also changed. I don't know if you've seen our latest circumcision ad. We're saying men and women need to talk together. Up until now, we're saying men must talk to men. Now we're saying men and women need to have the dialogue, because a man's sexual health is just as important for his partner as what her sexual health is for him. And if those two are not talking to each other, we're going to continue having these problems. So it's about men talking to men where they can, and it's about women and men talking to each other.
Love it. Thank you so much, Richard, for that. And yeah, but those are small actions where you are, and whichever area that you can influence, be it your nephew, as you've just heard from Richard, that will have a wide-reaching ripple effect. So perhaps that's the message that we need to be pushing as well. Well, for me, for now at least, it's a quick ad break. Morning Live continues after this. Stay right where you are.